afternoon and welcome to the University of Minnesota's Parent and Family Weekend Student Support Panel Discussion. I'm Dr. Kitty Jackson, Associate Vice President and Dean of Students, and we are thrilled to have you here today. Together, we're going to learn more about your students' experiences and campus life, resources available to support their journey at the university. We have a solid panel of experts ready to share their insights and experiences with you. Before we begin, we'd like to acknowledge the important role that parents and family members play in our students' lives. Your support and encouragement make a significant impact on their academic and personal growth. Today, we hope to strengthen the connection between you and our university community. I vividly recall my freshman year's Parent and Family Weekend. On Friday night, I was out late, not realizing the date, and the next morning, I was rudely awakened by my parents knocking on my door. We spent the day walking around campus, had lunch at a nearby local restaurant, and attended a talent show that evening. We shared many laughs. I successfully stayed awake the entire day, and throughout that experience, I felt an immense sense of pride as I shared my new home and life with them. We're going to cover a lot of ground in the next hour, including discussions on belonging, well-being, and more. You'll also have the opportunity to ask questions and interact with our panelists. But before we dive into our discussion, let's take a moment and introduce our panelists. Each of them brings a unique perspective to the table. We'll start with just brief introductions, your name, pronouns, role, and office. And I'm going to start with you here, Emily.
Okay, hello everyone. It's good to be with you. I'm going to try to adjust the microphone accordingly. I can't tell how my voice is projecting. My pronouns are she, her. I'm a manager in the Disability Resource Office here on the Twin Cities campus.
Hi everyone, I'm Alexa Palika. I use she, her pronouns. I'm the Prevention Program Coordinator at the Aurora Center, which is our campus's Sexual Violence Resource Center.
Hello, good afternoon. My name is Nina Hernandez-Bython. I use she, her pronouns, and I work as the Diversity Liaison Counselor at Student Counseling Services, where we offer mental health resources.
Hello, I'm Michelle Trumpy. I use she, her pronouns. I'm the Director of Public Health at Boynton Health, which is the campus health service.
Thank you. Now, without further ado, we're going to get this exciting discussion started with a deeper understanding of University of Minnesota and the experiences our students are having. So our first question, and you're welcome to go in whatever order you please, what drew you to this work, and also what keeps you there?
Okay, I'll go. So I have a master's in public health from this fine institution. It is one of the top schools of public health in the country. I was very proud to go here. And I really care about the health and well-being of large groups of people. So thinking about college campus is really exciting to me. This is an opportunity where young people are taking care of themselves, have all of their healthcare needs in their hands for maybe the first time. They're developing a lot of skills. They're learning a lot. It's a wonderful time of growth and development for them. And I am really excited and honored to be part of that here at the University of Minnesota.
This is Emily Ellinger speaking. Again, I'm from the Disability Resource Center. What drew me to the work is my own experience, learning about my identity as a person with a disability, a disabled person, as a college student for the first time, and not seeking out accommodations for a lot of reasons, even though I would have benefited from seeking them out. So it really got me interested in how campuses provide supports to disabled students, how we get students connected for accommodations, and also how we design environments, programs, policies, courses to be accessible and inclusive from the start, so that accommodations are an option, but students don't have to wait and have access from the beginning. And that's some of the work we do in the Disability Resource Center, as well as individual accommodations.
So I did not have many prevention opportunities in my undergraduate campus. I did not go to the University of Minnesota school system. And that's something that I really regret and wish I got to do. So in my role as a prevention specialist, I get a lot of opportunities to work with students, staff, and volunteers who are really passionate about the work and really inspiring. And I get to do a lot in my role and be creative with the type of programming we offer. But we're also a dual resource center in that we have prevention and we have direct services, which is when you think of a sexual violence resource center, probably more of what you think of. So very happy to be an advocate and work with a team of folks who work directly with clients to get them the services that they need.
I was thinking about this question, and I have my fancy answer and then my honest answer, so we'll just go honest today. And the way I originally got started was I was in lots of trouble in high school. I was a pretty wild teenager and had to do community service hours, and I did those helping folks, Spanish-speaking folks, learn English, and I just loved it. I was oh, I can actually be of service and not just really going through my own thing. And so I went to school for social work. I worked in community for a long time. I had a really difficult time in my undergrad, but I had some really supportive adults that were there for me. And so after working in community for about 7 years, I decided to come back to higher ed, became a therapist, and I interviewed here my finals week of my master's program, and I've been here 6.5 years since then. And it's really been powerful to be able to see myself reflected in the students I'm working in. My role specifically really looks at making mental health care more accessible to larger numbers of folks who historically might have been hesitant to access mental health resources. And there's a lot of really important partners on our campus that are also committed to that work. And so what keeps me here are the students, colleagues, and being able to feel that support to be creative and to come up with new ideas.
Awesome. I'll answer that question as well. I first started working with college students as a sophomore in college when I was hired as a community advisor in the residence halls. And so, and I've been working with college students every day since. And so it's very exciting to be collaborating with people who have an interest in improving themselves and their communities. And so I'm inspired every day by our staff who shares in that mission and our students who show up and are committed and inspiring. And so that's kind of the interesting things about some of our careers. You come in hopes of inspiring others, but really it's the people that you're serving who can in turn inspire you. So, all right, our next question, 60-second summary of your office. And the clock is going to be right here. So just kidding. About 60.
I can start, and then you can flag me when we're... I need a 5-second warning, though. That'll be great. Okay, my 60-second spiel. So as I said, I work at Student Counseling Services, and we are one of the mental health resources on campus. So we offer free, confidential, individual counseling as well as group counseling to students. So students are able to come to get support for short-term counseling. We typically work with our folks about every other week or so. And then we also do a lot of referrals to community. So if people have a more longer term challenge that they're experiencing, we would help them make sure they get connected with a good mental health resource in the community outside of the university as well. So that's kind of the individual counseling side of the house. We also have a really strong groups program where we do some specific counseling groups for folks, for example, who have had a parent die, for people who are survivors. We have one for kind of relationship challenges. And then we also have affinity groups for different cultural identities and educational workshops. I'm one of the facilitators for a sex ed workshop. We also have anxiety workshops and that type of thing. And then we also have programming in our office. So we do more of the prevention side of things, so kind of similar to what you're doing, where we go out, we talk to students in classrooms about mental health. We do prevention work there. And then we also support a program called Let's Talk, So Let's Talk is a more informal drop-in space where students are able to go and just get support that day, so they don't have to sign up for like ongoing counseling. There's not a lot of paperwork. I love to tell families about that one because it's usually the easiest sell, because you could just be like, just look at the website, just find someone you like, you can try it out. If you hate it, you can leave. So that's usually like the easiest sell for folks, and then we will get students information about different options if they want longer term or short-term counseling on site. Was it okay? Yeah.
That was great.
I can jump in next. So again, the Aurora Center is our campus sexual violence resource center. We kind of have two prongs to our work. My side is the prevention side, which is outreach, as I'm doing here. We also do a number of different avenues of programming, which includes workshops by request, and as far as services that might be a little bit more relevant to students as they're incoming immediately, would probably be our direct services. Our advocates are confidential, so we are state certified, we are trained, and that essentially means that we are a space where folks can share information and know that it's not going to be passed along as it would in a formal reporting process. Some of the things that we can help with is some initial crisis counseling. We're not therapists, but we can kind of do some chats with folks to figure out what's going on with them and refer them to the appropriate resources, whether that's with us or any of our awesome partner offices as well. We can help folks if they need some advocacy for their classes, if they're struggling due to experiences of trauma. We can support with some legal processes, with formal reporting processes, if they would like someone to be there, as well as a number of other services.
So Boynton provides comprehensive healthcare right here on campus, and we also provide public health services and programming as well. We are conveniently located. Our main office is on the East Bank, right behind the Union, but we also have an office in St. Paul. We have an office on the West Bank. We do some work in Rockwell. We do some work in Kaufman. So we're a little bit kind of all over campus. I had to bring my paper because I want to make sure to tell you all of the things that we offer. So urgent care, quick clinic, that's like a minute clinic. We call it Gopher Quick Clinic, which is a very fun name. Primary care, so regular checkups. We have a pharmacy that has prescriptions. Students can transfer their prescriptions. They can also get really low cost over-the-counter items too that are common for college students to need. Mental health, including therapy and psychiatry services. We have a full-scale dental clinic where people can come for their preventative checkups. They can also get dental care if they need it, including emergency dental services. We have an eye clinic that provides comprehensive eye exams and a full-scale optical and contacts. We have physical therapy. We have nutrition that is offered by registered dietitians. We have gender care, and we have a wide variety of immunizations. It is immunization season. It is time to get your flu and COVID vaccinations, and our Gophers on campus have been doing just that. We also run a food pantry and a free late night ride service that also has an awesome name, Gopher Chauffeur. And we provide support for students living in recovery, and we have a weekly group for them called Rock Recovery on Campus.
Okay, this is Emily. The Disability Resource Center, we serve students and we serve faculty and employees and guests of the university. I'm a part of the student side, student access. And the Disability Resource Center at the U is really unique because we're positioned under the Office for Equity and Diversity, and that really informs the way that we approach disability. We look at it as a very common, natural part of human diversity and an aspect of identity. So we work with a really wide range of students. We work with undergrad, grad, professional students. We can work with students at any point during their academic career. And we serve students with a really wide range of disability and disability identities. That includes mental health, like bipolar, PTSD, depression, chronic health, medical conditions, for example, Crohn's disease, migraines, as well as blind low vision, autism spectrum, really wide range of disability and health conditions. Students can get started with our office at any point in time, and we recommend early planning to students. And so it doesn't have to be in their first year that they're here. It could be at any point that they learn that there might be something going on related to a disability. They can reach out to our office. And we have 2 pathways, a gold pathway, which is setting up a meeting with our office, meeting with an access consultant to talk about and review access needs. We have a maroon path for some kinds of accommodations where a student can upload their documentation, complete supplemental questions, and get started with accommodations. So a couple different ways that students can come in. What we do is we look at what are the barriers that come up in the academic environment and what does that mean with regard to the kinds of accommodations and access that might be most beneficial for the student. So we create individualized accommodations for the student in the form of a letter, and that student then shares the letter with their faculty and instructors so that they're aware of the kinds of accommodations they need. And then that student will work with the access consultant from our office for the rest of their time at the university. That person can be a resource around what are the access needs that are coming up, are there any adjustments to the accommodations that need to be made. We can also share resources with the student. We're commonly connecting students to our partner offices, many of whom are on this panel, as well as different community supports, both within the university and outside.
Thank you. I'll share a little bit about my role as Dean of Students. And to talk about that, I like to highlight a metaphor in which the university is really like that of a human body. And there's different parts of the body. We'll start with the president and his senior leadership team. They're the eyes. Eyes on the horizon, figuring out what are the needs of the state of Minnesota and beyond, and how can the university help to serve them. And so very important parts of the body. Next, we have the faculty, and they are the mind, always creating and conveying new knowledge and ways of thinking about ourselves and our communities. And then we've got the backbone, folks who ensure that we have lights and sound here today. The temperature feels pretty good. We've probably had to purchase something, so procurement, all those different pieces that come together to keep our community humming along from day to day in our physical spaces and online. They're the backbone. And so with the Dean of Students and Student Affairs, I think we really are the heart of the institution because we feel what it means to be a college student day in and day out, at the best of times and at the worst of times. And so I wanted to highlight, I have 6 units that report to me, one of which is the CARE program. If ever you're concerned for your student, you could make a report to the CARE team. And so many faculty do that each day. They might receive a concerning email from a student, or they might observe something in class that's concerning to them. And so they can connect to the CARE team, and then the CARE team will reach out to students to share information about resources that we have and to invite them to meet if they want to go over anything that's going on for them. And so CARE team is an important unit to be aware of, and you're welcome to connect with them as needed. All right, so when students want or need your office's services, how can they connect?
Okay, this is Emily from the DRC. The best way for students to connect for us, they can send an email to our front desk at drc@umn.edu or get started on our website. There are student information forms that students can fill out, and then our front desk will follow up with them about next steps for getting accommodations set up. We also have drop-in hours every day, Monday through Friday, from 11 to noon and from 2 to 3 p.m. Those are virtual, but also physical. We're in McNamara Alumni Center. Sometimes we're told it looks like a strange spaceship building if you've never been there. And students can come there for questions too, to our drop-in hours is another way to connect.
And quick follow-up to that, Emily. When might a parent refer a student to your office as well? What are some things they might see that might help them to know that you're the person that can help?
Yeah, I think if your student is experiencing any impacts that might relate to a disability or health condition, that would be a good time to suggest connecting to our office. If they've previously had accommodations, sometimes we see students who, once they get to college, they want to try to not use their accommodations, and that's okay. But even if a student thinks they might not need their accommodations, they could connect, get set up just in case they need to use them. But also, if things are coming up related to mental health, we talked about depression, anxiety, it could be in some cases we're involved when there's a temporary injury if the faculty can accommodate, like a broken wrist or ankle. So any kind of health condition where you're starting to notice there are some barriers coming up and the student might need some additional support, connecting to their instructors about modifications that might need to be made.
Yeah, so at the Aurora Center, all of our information about our services can be found on our website. So if you'd kind of like to look along with me, our website's aurora.umn.edu. Aurora as in like Aurora Borealis, the lights, or Aurora the Disney princess, if you need a spelling. We can pretty much be reached in most of the ways that people reach each other nowadays with technology. So we have a 24-hour helpline number, so we can be reached by that number during business hours or anytime after hours. We have a business line for during office hours, which are from 8 to 4:30 in Appleby Hall, which is just a couple buildings over from here. Folks can walk in, and if we have capacity, we can do drop-in appointments. We can be reached via email with questions, to schedule an appointment. There's lots and lots of ways. And there's even a text line during the day for students. One way to know if your student would be able to access our services is if they are expressing that they are a victim survivor of some sort of form of sexual violence. We are a confidential resource, so we will work directly with that client, and only that client unless they say it's okay to communicate with other people. But the best way is to just have a chat with them and let them know about our resources, and let them know that we are here when they are ready to reach out and seek some help.
So for our services at Student Counseling Services, I think some things you could be looking out for if you notice that your student seems to be more depressed lately, so they might be feeling really low energy, having a hard time getting to class, feeling sad, feeling like maybe they aren't doing the same activities that they usually enjoy doing, or if they're seeing that they're feeling a lot of stress. Those are kind of some things that I would look for. At Student Counseling Services, we don't work in a medical model, so we don't do diagnosing. We're able to kind of just work with folks with what they have. A lot of students are unsure about how their parents might feel about them accessing counseling, so would encourage you all to be really verbal and supportive, and to say that we want you to get the help you need, and to reassure your students of that. And we also know that mental health formal realized resources are not the only resources on campus. There's other options, advisors, faculty. So to be encouraging your student to reach out where they feel comfortable would be helpful. If they were to be interested in doing ongoing counseling, they could get that started at our website. So you can just Google Student Counseling Services UMN. It will pop right up. And there's an online form there they'll fill out, and then they can schedule the brief consultation themselves, where one of our counselors will go through some questions, get a better understanding of what's happening, and then make recommendations and referrals for next steps. If they were maybe not interested in ongoing counseling, but they have a specific problem, or they're kind of unsure about counseling, but they're like, maybe I would consider it, or maybe they just want to talk through something with a counselor, Let's Talk would be a great resource for that, and you can find that on our website as well. We have virtual and in-person drop-in hours 5 days a week around campus and online, and students can pick which counselor they want to meet with, and we have folks who speak a variety of different languages, different experiences on our Let's Talk team.
Yeah, there could be lots of reasons why students might come into Boynton, and maybe you as family have already received that first call. My throat hurts. I'm feeling kind of sick. I'm not sure what to do. Boynton would be a great resource for that. So we have walk-in to our urgent care, and we're open Monday through Friday, 8 to 4:30. We also have resources on our website about local care outside of Boynton as well. We also have urgent counseling services that students can walk into. We have a drop-in vaccine clinic if they need those services. So we offer flu, COVID-19 vaccine, Tdap, HPV, and Mpox vaccine on a drop-in basis. We update our hours regularly. Right now it's Monday and Wednesday from 8 to 3. We also have that dental clinic. If there's a dental emergency, students can call, and we almost always have same-day access for a dental emergency. We also have ways to make an appointment with us. So online, students can make a variety of appointments online, or they can call. We now have online appointments for first therapy appointments. So that's a really great new resource that we have for students. And we are piloting some early hours and some kind of evening hours as well, and that's going very well. Students can drop in and visit our pharmacy. It's really easy to transfer prescriptions from home right to our pharmacy here. There's just a quick form you fill out. Our pharmacists are awesome. I actually transferred all of my scripts to Boynton because I love how patient they are. I love the time that they take. Our pharmacists are really invested in connecting with students, answering their questions, teaching them along the way. There's also really awesome over-the-counter products at steeply discounted prices that are great. And then we have a 24/7 nurse line. And so if your student is not sure, like, is it bad enough to go to urgent care? Call the nurse line. They're happy to talk through that. They're Boynton nurses, Monday through Friday, 8 to 4:30, and then it's Fairview nurses that cover our overnights. And so that's a really, really great resource as well.
Great. And if a student's needing to contact the care team, they can do that at osacare@umn.edu. And our care team's located on the second floor of Appleby Hall in 205. And for the most part, it's other community members who are going to refer students to care. They don't often seek care out directly. But again, they really function as a clearinghouse for a student who's in need of support but is not really sure where to go. And so they can help students connect to on-campus resources as well as off-campus resources if their needs are beyond those that can be served on campus. And so we sometimes have students who are working with the county on things like housing insecurity, and so they can help to connect students to the correct folks off campus as needed. For on-campus services, students who are struggling with grief, initial concerns relating to mental health, students who have basic needs and are in need of support, aren't quite sure how to navigate, the care team's a great place to start. All right. So our next question, what is something that's often misunderstood about your office?
So I think a question that we get a lot is who qualifies for our services, or who is able to access our services. Again, I'm the Aurora Center, which is our campus sexual violence resource center, and we serve all students, staff, and faculty at the U, so both undergrads and grads. We support people who have experienced sexual violence and folks who are supporting those people or have concerns about those people. We're always here to answer questions of folks who have questions about our services. So if you ever have questions, feel free to call and refer your students to us if they have a need for services.
So just a few common questions that people have about Boynton Health is it a student-run clinic? It is not a student-run clinic. All of our providers are experts in their field in college health, fully licensed providers. Another question is the payment. We get a lot of questions about that and how Boynton is supported. So we do bill insurance for the services that are provided. And if your student pays the student service fees, which if they take more than 6 credits in person, they likely are paying the student service fee. The amount of your bill that's not covered by insurance will actually be paid by the student service fees. So that's how we can keep costs very low to students. It's a really wonderful benefit. That's where that student fee portion goes when you're paying it to Boynton. And so it's a really great cost-effective way to get service on campus. There are some things that are not covered by the student service fees. So anything that happens in the dental clinic, medications, supplies, for example, if a student were to need crutches or other durable medical equipment, contacts, glasses, and any sort of exams that are covered for requirement, not from a medical perspective, those would not be covered by the student service fees. There's also questions about like, how long is the wait? We can often see students more quickly at Boynton than what's happening in the community. So for dental services, our wait time is a couple of weeks for a new patient, which is really awesome if you're establishing care as a dental patient. For our mental health therapy, the wait is about 3 weeks to get into that service, and we're working very diligently every day to trim that down. So those are just a couple of examples about some of the wait times. And then the other piece is just, where are you located again? So our main office is on the East Bank location, just behind the Union. We also have a clinic space in St. Paul. We provide mental health appointments in West Bank in the Wilson Library. And we do physical therapy and nutrition appointments out of Reckwell. And we also, I didn't even talk about the PAUSE program. Pet Away Worry and Stress is a wonderful, wonderful program where we bring registered therapy animals to campus 4 days a week at different locations, and students love interacting with the animals. It's a great stress buster. There's dogs, cats, chickens. Yep, there's therapy chicken. Hennifer is one of the therapy chickens that comes. I love PAUSE. That happens in Reckwell. It also happens at Kaufman Union. It happens in St. Paul, and it happens on the West Bank. So lots of accessibility. And then at Kaufman Union, which is right here, this building, we have PAUSE, and we also have our Nutritious You food pantry. And that runs 2 days a week on Tuesdays and Wednesdays on the full second and fourth weeks of the month. And so that is a service that is very, has high utilization here on campus.
For student counseling services, I think a couple logistical misconceptions folks have is, again, wondering about cost. We don't bill insurance at all, and so all of our services are completely free of charge. They also don't go through insurance. And then we also will get questions about confidentiality. Students will wonder if their counseling information is going to be tied to their student record, who might have access to that. And so we are a fully confidential office, and so they would need to sign releases of information for us to share that information. So we like to let them know about their confidentiality. And then I think kind of more broadly speaking, there are some kind of misconceptions about therapy. Sometimes people have tried therapy in the past and they just didn't have a good fit for a therapist, and they'll be like, therapy is not for me. And really, like, finding a good therapist for you is kind of like finding a shoe. Like, it's not like, just everybody is not for everybody. And so finding someone that can be a good fit can be really important. And so we get a lot of people who will come in like junior, senior year, and will be like, I should have come in sooner, but I just didn't actually think this was going to help. And we're like, we're really glad you're here. And like, that's understandable. So just to encourage folks to try again if they maybe didn't have a good experience in the past. And then we also have a lot of students, especially in Let's Talk, who will say, I don't know if this issue is like legitimate enough to like be worried about, but I'm like really stressed about it. So that could be things like roommate issues, just being like, I don't know like what schoolwork to do this weekend. Like I'm so overwhelmed, I don't even know what to start. Like no problem is too small. Like we really can help folks talk through those types of challenges. And therapy, it can really take time. It's a process. And so sometimes there are really big pieces that have happened in folks' lives, and we're there to support them. And we also will do referrals to off-campus support as needed if they're wanting to continue their therapy journey.
This is Emily from the DRC. A couple misconceptions about our office. I think we still hear from a lot of students that they weren't aware that they could use our office, and that is a part of the reason why we try to talk about the really wide range of things that can fall under a disability or health condition. Sometimes we have students who are concerned and don't come to our office because they feel like they're receiving a special advantage over their peers. And we talk about the fact that accommodations are really designed to fix something that wasn't built to be accessible for everyone. So students are still meeting the same standards, meeting the same requirements in their class. How they do it is the access need that we're looking at. And so we really try to drive home that this is really fixing something that's not accessible, not a special advantage to students. Another piece is that students often don't know that accommodations are best used in tandem with skills building. And so we often talk about accommodations are one piece of what the support system looks like for a student. And so when students do come to the Disability Resource Center, we'll often talk about referrals to student counseling services or Boynton Mental Health if there's mental health related things going on, or some of the academic skills coaching. And then lastly, some students think that their 504 plan or their IEP, if they've had one in high school, will automatically transfer. And the Disability Resource Center doesn't have any way of knowing who would have had accommodations in their high school. So making sure that students still connect. And even if they don't need accommodations right now or even identify someone with a disability, it doesn't mean that down the road in their undergraduate career something won't come up. So knowing about our office, knowing that we can be a resource is, I think, important from the start.
Great. For the care team, just a few misconceptions. They are not a 24/7 care team, and so they operate during business hours. We do have 24-hour crisis response available for students, and so if a student is having an emergency, they can call 911 for a first responder. We also have a mental health crisis line run out of Boynton that is 24 hours a day as well, and so those are some options for students. That 24-hour crisis line is on the back of their student ID as well as on the Boynton website. So with that, I'm going to wrap up with a final question for the panel and then open it up to you all for any questions you may have. Is there anything that I haven't asked that you would like to share about your office? Covered it? All right. In that case, I'm going to steal one of your microphones and I will come around to any questions we may have out in the audience.
Yeah. We can help, Katie.
All right. Thank you so much.
I just am very curious if there's an urgent care need, not an emergency need, on the weekends, what is the closest location for the students to go to?
Yeah, so from an urgent care perspective, those locations are all on our website. We are right next door to the East Bank Hospital. That is the closest ER. There's also an ER on the West Bank. I know you didn't ask about that, but I would check the website to see the closest urgent care. And just for urgent care, for two things. One is, if if the student isn't sure, like, does this need to be seen right away or can I wait? The 24/7 nurse line is a great way to triage that. And then our urgent care, we do have access to, right in-house at Boynton, we have a lab that's very comprehensive, and we also have x-ray capability. We had a student who had a skateboarding accident who came in like 8 a.m., skateboarding on the way to class, needed urgent care, needed some x-rays, was seen and was able to get the help he needed to move on with the rest of his day. So it really is a solid, comprehensive service.
Good question.
So my question is, how can parents find out more? So, I know we can't ask about what, you're doing with our students because that's confidential. But if we have questions about, I don't know, like approach or philosophy or, something, just to take an example, my student is using language that my husband is uncomfortable with. And so, it's like, how do we learn more ourselves to educate ourselves? And are there resources for parents?
Absolutely. So Gavin Gribna is our parent and family support, and he helped organize this event. And his office is just 2 doors down from mine, and he takes parent phone calls all the time. He does a great job of listening and then helping to advise. And in addition to that, our Gopher Family Connection is a newsletter that you can sign up for on the parent and family website, and they address all kinds of common topics that parents might struggle with in supporting their students. And so it's specialized to the University of Minnesota campus. So you also get information about services and programs and events that we have happening here. So encourage you to sign up for that newsletter if you are not already a member.
I have 2 questions. My daughter, I believe, probably has not let her CA or anyone in her dorm let them know that she's got a chronic condition called POTS. And it's a blood pressure condition that many people have. But what happens is if she gets up too fast, she'll collapse and she could hurt herself. She's already fallen downstairs and things like that. And so what is her best step for going to, like, should she talk to her CA and get that registered, or should she do that somewhere in Boynton Health? Because of course I've told her, and so I'll be asking her this weekend to see if she actually did it or not. So my concern is that, through elementary school, middle school, high school, she's had an incident, every couple of years where she'll just collapse, she won't remember anything. And, I just don't want her to like break bones or crack her head open or something like that, as a parent. So what would be the best place for her to go to have that on record? So in case something like that happened, I wanted somebody in her dorm room to know about it, but I'll have to see how far that got.
I will let Emily kind of start with that one, and I can add on. Thank you.
This is Emily. I'm from the DRC. So I do think, your student could connect with the Disability Resource Center to talk with an access consultant, and what they would probably do is explore too whether there's any accommodations that your student might need. Sometimes we do explore accommodations related to housing, although there might not be any specific kind of accommodation, but we can also chat through with the student how to talk through a care plan with their provider and who they might want to share that with. We generally don't do communication around care plans, but we can talk with the student about who they might want to communicate that with, or who they might want to share that information with. And if they have an established care provider, we usually will suggest the student talk with them about what might be some steps to take if something were to happen when I'm in a classroom, in a dorm, if I'm out and about on campus. So those are a few initial thoughts.
Okay.
Yeah, I was going to say that your daughter is absolutely welcome to come to Boynton to establish care. And it might be nice for her to come and just see where it's at. She can always make an appointment for primary care for a checkup and just, explain what's going on, and just to have that point of contact in case she needs something while she's on campus. And certainly, if she's got another provider at home who's really overseeing that condition, that's absolutely fine. But she can also have a provider here on campus, and we'd work with the DRC as appropriate as well.
Okay. And then probably my other question is also for Boynton Healthcare. So we have Anthem Blue Cross Blue Shield. Can she still use your services even though we have insurance through them?
You sure can. She sure can. Yeah. So what will happen is that if she pays the student service fees, so that's kind of the asterisk here, we will bill Anthem Blue Cross Blue Shield for the services provided. They'll pay what they pay, which it's hard to say what that is. And then depending on that service, like if she went and saw primary care, the rest of that would be covered under the student service fees. And if there's any questions about billing or you want to know ahead of time, I just want to double triple check that. Or she went to primary care, but now we're seeking this other kind of service. Our billing department is great at walking through that and can talk you or your student through that.
Okay, and we get our prescriptions through CVS Pharmacy. Can she pick those up at Boynton's Pharmacy?
Yes, there is a very easy script transfer form that's right online, okay. And those can be transferred
easier than her going off campus to the other CVS or wherever it is. So,
yep.
Okay, thank you so much.
Any other questions out there?
I was just going to add while we wait for our next question, kind of in combination with this question about where can parents call, we wouldn't be able to discuss specific, we couldn't share with you about our work with a specific student, but we can definitely have hypothetical conversations and provide recommendations in our experiences in working with students. And so I think one question I think it's a really important question, how do you all as family support your students as they're in this new phase of their life? And if you're I clearly see it's going to be really important for you to do these things, and your student might have kind of a different idea about that. And so one of the things I would just say is to really be curious, lean into curiosity with your student about, okay, so if you haven't informed folks or if you haven't reached out for support yet, whether that's physical, mental health conditions, sexual violence, can you just share more about why that is, and just to be really curious in there without any shame or judgment or blame, and then to see if there's something that they might be willing to do. So perhaps they don't feel ready to go and to tell all of their faculty, or they don't feel ready to go to the DRC, but maybe they would be willing to tell their roommate, who could then get the CA support, or maybe there's one thing that they would be open to doing. And so it's a lot of kind of trying to support your students from afar, and just to really, I'm a parent of little kids, and I'm I'm not looking forward to when this happens for me. I'm sure it's really difficult to not have that same type of way to support them, but I've really heard from students how helpful it is when their parents and their guardians and their family are able to kind of help them problem solve and see what they might be willing to do.
Expert advice. You heard it here.
I got the letters to back it. I was kidding.
She does. She does. All right. What other questions? All right. Well, all of us will be up here for a couple minutes if you have a question that you'd like to ask in a little bit more of a private setting. And so feel free to come find one of us. But I want to thank you again for joining us today. The fact that you are here supporting your student is really a testament to your support and their success. Not all students have that. And so thank you so much for being an active part of your university college experience for your student. And I really hope that you enjoy the rest of your family weekend. Thank you so much.